So perineal care. Perineal care is provided on a female mannequin, and the mannequin is laying on a pad that is saturated with urine. You're asked to cleanse the resident appropriately and leave them on a dry pad. Now we're going to start this skill like we start any. We're going to knock. Hello, my name is Myra. I will be your nursing assistant. I'm going to go to your bathroom and wash my hands. And your name is? Miss Jones, nice to meet you. May I check your name band? All right, Miss Jones, I'm going to provide you with perineal care. Is that okay? Great. I'm going to give you some privacy, and I'm going to gather your supplies. Now, when gathering supplies, the first thing I gather are my barriers. My barriers will separate a clean and dirty surface. I will gather 2 barriers, 1 clean, 1 dirty, and 2 pads to place under the resident. Now, your clean and dirty barriers can be of various types and sizes, just has to separate a clean and dirty area. I will also gather 4 washcloths, at least. I will also gather a drying towel, as well as a bath blanket. All of these items must be held away from my body for infection control purposes. We will now bring them to the room. I place down my clean barrier first. Place my items on top, as well as place down my dirty barrier on either the side table or side chair. Miss Jones, is it okay if I gather some supplies out of your side table? Out of the side table, I'll gather the bath basin. Out of the top drawer, I'll gather the soap. As well as a pair of gloves for this particular procedure to maintain infection control. Miss Jones, I'll be right back. I'm going to gather some water. I'm going to go over to the sink, gather water. I'll be right back. All right, Miss Jones, would you like to check the temperature of this water? Is that an appropriate temperature for you? Great. I'm going to raise your bed up to a comfortable working level. I'm going to bring the overbed table closer to me. Miss Jones, is it okay if I lay your bath blanket on your bed? Okay. And I can place my supplies in order of use. We have a pad, 2 washcloths, a towel, 2 washcloths, and a pad. I will now place my gloves on. Miss Jones, I'm going to put on your bath blanket, provide you with warmth and privacy. We do not shake or flap the linen. We open it up on its surface for infection control reasons. Miss Jones, I'm going to pull down your top sheet so as not to get it wet. And I'm going to pull up your gown. I'm going to assess your position in bed. On 3, I'm going to have you come towards me. 1, 2, 3. Good job. Now I'm going to remove this pad that is saturated with urine by first rolling it in towards the resident, placing it just under the furthest thigh. All right, Miss Jones, I'm gonna have you turn away from me on 3. 1, 2, 3. Now I will begin rolling this pad. Sometimes the mannequins don't want to cooperate. Towards the resident, as well as place a new pad. I can remove this one and replace with a clean one. That one will be placed in the dirty area, and this one can be placed underneath that thigh again. On 3, Miss Jones, roll back onto your back. 1, 2, 3. Now you're going to begin perineal care with a clean surface. Miss Jones, I'm just going to open up your thighs to expose the perineal area, and we will begin with our first cloth. We'll wet it prior to putting on soap. Squeeze it out, any excess water. We'll put some soap on it. We will not place it back into the basin because then this water cannot be used to rinse the resident. So once it's got soap on it, not back into the basin. So now we're going to begin cleansing the perineal area, furthest external labia, palm down. So wipe, palm down, external labia, palm up, external labia closest to you. We're going to open the inner labia, and the pointer side of the cloth, we're going to do the inner labia furthest away, and the pinky side of the cloth, we're going to do the inner labia closest to us. We're going to cover the resident. We're going to dump this in the dirty area and retrieve a new cloth to rinse. We're going to thoroughly wring out any excess water. We're going to come back over, and in the same manner, we're going to rinse, starting palm down, external labia going from front to back. Flip, back of the hand, front to back, clean to dirty. Open, furthest labia, pointer, front to back, pinky, front to back. Understanding that the meatus, the entry point of the urinary system, is very close in proximity to the rectum, so you never want to wipe back to front. Every wipe must be done front to back. Now we're going to dry using the same technique and using different parts of the towel. So we're going to start external labia, pat dry. Use a different part of the towel. External labia closest to you, pat dry. Different part of this towel again. Internal labia, open up, pat dry. And a different part of the towel for the internal labia again, pat dry. We're going to flip the towel, and we're going to proceed to cleanse the buttocks. Miss Jones, prior to cleansing your buttocks, I'd like to assure you that the water is not cold, soapy, or dirty, so we will continue to use it. You must verbalize that portion so the evaluator knows that you know not to utilize water that is cold, soapy, or dirty. So again, Miss Jones, the water is not cold, soapy, or dirty, so we'll continue with the procedure. All right, so prior to turning you onto your side, I'd like to prepare this pad for removal to reduce the amount of times we have to turn you. And I will have you turn onto your side so we can clean your buttocks. On 3, you will turn onto your side. 1, 2, 3. Good job. We will cover you for privacy while we prepare our cloth. Now our towel can stay right here on the bed because it is the resident's microorganisms. Just in case you were wondering where that went. Now we'll wring out the washcloth again. We'll put some soap on it and make sure the front and back are lathered, and we will now put it back into the water. Again, starting from clean to dirty or front to back, we start with the palm of the hand, going front to back, gluteal pad. This is where some students get confused because you have to flip and use the back of your hand, front to back, gluteal pad, pointer, gluteal fold, pinky, gluteal fold. Now we're going to get another cloth to rinse. Definitely cover the resident for privacy. Preserve as much dignity as possible. All right, we'll do that again. Same technique. Gluteal pad, palm down. Gluteal pad, palm up. Gluteal fold, pointer. Gluteal fold, pinky. Cover while we prepare the towel. Now, same process. And again, reduce the amount of contact you're having with this towel to none, except for the gloved portion of your hand. So we're going to pat, switch the part of the towel, pat, switch the part of the towel, fold, switch the part of the towel, and we're done. Miss Jones, I'm going to remove this pad. Now, if you did not put in the pad or tuck in the pad on the other side, or didn't tuck it in well enough, you can go through the other direction. So I'll show you that now. And I'll tuck these both in, and then I'll have Miss Jones come on to her back because I didn't quite tuck enough. Miss Jones, back onto your back. 1, 2, 3. All right, now that she's here, I can then remove the pad we cleansed her on and extend the new pad. All right, so now that we've got that done, ensuring Mrs. Jones's privacy, we can roll this down and pull this up. Miss Jones, are you okay while I go dump the water? All right, I'll be right back. I'll go dump this. So I'm going to dump the water. I'm going to turn on the faucet, rinse, and dry it out. And grab a piece of paper towel or even a tissue to then put it away. So I'm going to, with the tissue, open the drawer, and this will provide a barrier from your dirty gloves and that clean drawer, so we don't have to remove our gloves. We will place this in there. We will place that barrier there. We will grab another barrier. Now we're gonna have to cut that part out. So we will open this drawer, place this in here, close this, going from clean to dirty, gather this as a package and remove it to the dirty utility area. Miss Jones, I'll be right back. Now your dirty utility area is considered to be in your room, so you don't have to worry about the height of the bed or the call bell. When removing your gloves, make sure you remove them appropriately for the state. Now, when removing your gloves, you will start with removing the glove from the non-dominant hand, inverting it onto itself, and then with the non-dominant hand again, you're going to go to the inside of this glove and inverting it onto itself. Immediately after, you will discard this glove and state to the evaluator that you are washing your hands. Miss Jones, are you comfortable? Do you need anything before I go? Well, that's great. Here's your call bell. If you need something, give me a ring. If not, I'll see you in about 2 hours. I'm gonna lower your bed. Would you like your call or your curtain opened, excuse me? All right. Evaluator, I did not notice anything on the resident's skin. No complaints of pain or discomfort. Wash my hands and I'm done.